Testosterone. It's something that every single one of us has in our body. But what is it? And what does it do? What are the potential health consequences of having abnormally low levels of testosterone? Can we increase it naturally, or could testosterone replacement therapy be the better option?
Why is it so popular right now? There seem to be countless advertisements aimed at people like me, which make some incredible claims around health and longevity benefits.
Could TRT give us a better quality of life, particularly as we get older? What are its side effects, and is there an ethical consideration? Let's start with the basics. Testosterone is a hormone. It drives a lot of changes in the body during puberty, especially in males whose levels of testosterone can increase by up to 20 times through that period of life. In adults, it plays an important role in maintaining or boosting strength, muscle mass, bone density, mood, energy levels, and sex drive. It does so by increasing protein synthesis, which is how your body creates new muscle tissue, by stimulating bone formation and by affecting the levels of certain neurotransmitters in the brain. There's a large discrepancy between testosterone levels in men and women, so on average, men have about 20 times as much in their bodies. But there are also fairly substantial differences between people of the same gender. Some of that is down to genetics, but it can also be down to lifestyle. So diet, exercise, stress and sleep can, and often do, play a role in testosterone levels. The other factor that I haven't mentioned yet is age. So in men, testosterone levels start to decline somewhere between 30 and 40 years of age, and on average, across the population, that decline is around 1 to 2% per year. In women, there's also a drop with age, but that decline generally comes around the time of menopause. It doesn't drop off a cliff like estrogen levels do, but it does drop. Is all or any of that a problem? Well, it certainly can be. Abnormally low levels of testosterone can result in reduced energy levels, weaker muscles, and lower bone density, so it's not great for your body. And more recent research shows that testosterone decline is probably not good for your mind either. Mood swings, difficulty focusing, even depression are linked with low testosterone. I should, though, caveat that by saying it's less conclusive whether the link is one way, i.e. there's a chance that bad sleep, bad diet and a lack of exercise are leading to low levels of testosterone and also to changes in brain function. Either way, you can see why people living with some or all of the negative effects of low testosterone are considering, or even having, testosterone replacement therapy. Is that okay? Physically and ethically? What are the considerations? Can it be bad for you? Before I get onto that, I want to talk about testosterone and sport. If you're watching this video on a cycling channel, you're probably a cyclist or at least interested in cycling. The mere mention of testosterone is frowned upon in cycling circles, and for very good reason. Why? Because it's a potent, performance-enhancing banned substance. Pro riders who've tested positive for it or admitted to using it over the years include, but are not limited to, Floyd Landis, Stephen Rooks, Gert-Jan Tjörnesser, Jesper Skibby, Francesco Casagrande, Laurent Roux, Tammy Thomas, Kirk O.B., Lance Armstrong, Jesus Manzano, Aitor Gonzalez, George Hincapie, Patrick Sinkovitz, Christian Morini, Matthias Kessler, Bjorn Leukemans, Michael Leipheimer, Christian van der Velde, David Zabriskie, Matt White, Michael Rasmussen and Mauro Santambrogio. And it's not just individuals. Team Sky and British Cycling, for example, were at the centre of a controversial case after it was found that one of their team doctors, Richard Freeman, who worked with them from 2009 to 2017, had ordered testosterone online in 2011. It was delivered to their headquarters in Manchester and came in the form of Testogel sachets. In the eventual court ruling, Dr. Freeman was found to have ordered the product, knowing or believing it was to be administered to an athlete to improve their athletic performance.
Today's verdict will cause lasting damage to the reputation of one of Britain's most successful sports. British Cycling, for one, has described today's finding that the testosterone was intended to dope a rider as extremely disturbing.
He admitted to charges against him. However, no cyclist or athlete has ever been charged in that particular case. My point is that there is, or at the very least there has been, a temptation to use testosterone, and that's because it's been proven to increase athletic performance. It can help boost production of red blood cells, which carry oxygen to fuel muscles. It increases muscle size and strength, and also helps with muscle recovery after intense workouts. As mentioned before, it can also increase energy levels, but it can increase confidence as well. Like I said, it is potent. Now, since it's a hormone that's been abused by cyclists and lots of other athletes over the years, it's no surprise that it's a bit of a taboo subject in the world of sport. It's also got an association with bodybuilders and gym bros, which perhaps dissuades or deters others from looking into whether it could help them have a better quality of life. However, most of us aren't bodybuilders or pro cyclists. Most of us don't even compete. So is it something that some of us should consider using? Could testosterone replacement therapy, or TRT, help us feel more energetic, be stronger and healthier at a certain time of life? I'm not qualified to answer that, but I have found a man who is.
My name is Simon Saunders. I'm a consultant physician in diabetes and endocrinology and general medicine. I work up in Lancashire. And part of my clinical work is dealing with patients who have problems with testosterone and come to my clinic to see me about it. I've also quite a strong interest in sport and have cycled for the past 20 odd years. So cycling, and I'm aware of the context of testosterone in the cycling community.
Yeah, it's got quite a strong one-way context at the moment. Let's start with the basics. How would one know whether their testosterone levels are normal or whether they are dangerously low or just low?
Effectively, from a knowledge point of view, and people may feel unwell, but they won't know why that's the case. And a lot of people present now to general practitioners complaining of vaguish symptoms, things like tiredness and fatigue and lack of motivation. And that might prompt the GP to do a certain amount of tests, but equally people may see this information on social media where testosterone testing is being pushed at them for a purpose of obviously supplying testosterone. Now, that can run either way, so people may have a genuine problem and need testosterone, or they might not have a genuine problem but think they have a problem and get tested and find either normal or abnormal results. So the context in which somebody presents to a doctor or presents for testing is really important in terms of why they went there in the first place.
So when you go for a blood test that includes testosterone, all of the results you get for everything have a, inverted commas, normal range. But how do you know, if you haven't done previous tests, whether your testosterone is in decline, or whether even if you're at the bottom of that range or just below it, whether you might always have been there?
You don't, is the short answer to that. The problem is with, I won't call it normal range, we'll call it a reference range, because it's just a reference range based upon the test. So the test itself, there are a number of different tests of testosterone. So each test itself will have a reference range. And if you go to a number of providers, you might get different numbers anyway. Testosterone rises and falls during the day. So it peaks in the morning and then falls off during the afternoon. So depending on what time you've taken it can influence the levels. If you've eaten beforehand, that can influence the levels. So we would normally, in the NHS, want people to do a fasted morning testosterone level and repeat that level as the guide of what is normal. If you've got night shift if you're a night shift worker, that messes around with your testosterone levels as much as it does with other hormones. So you can see how the context of testing also plays a part in what you would see. And whether a patient or whether a person would know whether they're normal in the normal range or the reference range is difficult, because people can report symptoms with normal results and people won't report symptoms with abnormal results. Again, looking at I would never make a decision based upon one test only. And I would want a number of tests to sort of get a pattern and a picture of somebody before I'd consider offering any treatment, because you can't make a judgment on a hormonal level based on one static test.
As Dr. Saunders mentioned there, individual testosterone levels can fluctuate throughout the day. That fluctuation is greater generally when you're younger than when you're older, but for males, peak levels normally occur in the morning between 7 and 10 a.m, and they can be up to 35% higher than later in the afternoon when they're at their lowest. This is why, if you do want to build up a longer-term picture of your own testosterone levels, it's best to always have the test done at the same time of day, preferably in the morning before you've consumed any food. Studies have shown that a pre-blood test meal can significantly lower testosterone levels. Now, one question that you may have that you're hoping this video will answer is whether excessive endurance training, which in most instances for those watching this will be cycling, could reduce testosterone levels. Some studies have suggested that it does, but according to Dr. Saunders, it's not as clear-cut as some claim.
Now, this is a very variable area of knowledge within exercise physiology, exercise endocrinology, within the medical profession generally. So short-term exercise actually causes rises in testosterone and other hormones as well. Chronic exercise has been associated with a decline in testosterone compared to people who aren't chronically exercising. But the research itself is complex and based upon small numbers, and it's very difficult to determine very clearly the exact relationship between chronic exercise, whether that's an adaptive thing that the body adjusts appropriate norms because tissues become more sensitive, so you don't need so much of it, so therefore the levels appear lower, or whether this is a disease state where chronic exercise is causing problems with testosterone production and therefore it goes into steady decline. There are various categories within exercise endocrinology based around looking at what exercise does to things, and some of it is related to energy availability. So if you're undernourished, that also has a contribution. If you're overtraining, there's evidence to suggest that overtraining will cause testosterone to go down more than somebody who's optimally trained or just doing recreational activity. So it's a very complex area and there's not a simple answer to it. I mean, I think even most recent research reviews can't conclude a definitive position on it.
Okay. So I also wanted to ask you that if you did have a patient and you took multiple data points over a period of time and your determination was that their testosterone levels are too low, what's your first port of call? What's your first pieces of advice to that patient?
I guess a little bit, I would be more interested in why they became, or why they presented for testing. Did they have symptoms that are consistent with low testosterone? So as I mentioned earlier, you can have a lower testosterone but have no symptoms at all. And from a treatment perspective, I wouldn't treat that, because if you're otherwise well, what are you treating? You're just treating a blood test, aren't you? But it depends upon the symptoms that a patient presents with. So if they have a chronically low testosterone or a testosterone that's in below the lower range, and they've got signs and symptoms that reflect that, so they can say, well, I've been feeling chronically tired, I've lacking motivation and drive, my sex drive, my libido has also fallen off, then there's signs and symptoms there to suggest that they're actually suffering clinical effects of low testosterone. And the discussion would then be about what do they want to do about that. So there's various different approaches depending on the cause of their problems. So testosterone deficiency is classically, from a medical point of view, divided into primary, which is caused by testicular failure, or secondary, which is caused by another cause, often a gland in the brain called the pituitary gland, not sending the signals to the testicles properly, but can be caused by things like obesity or other drug use or alcohol or training or exercise. So it's about trying to determine the underlying cause before you offer the appropriate treatment.
For somebody that has got that chronic case then, can it be down to bad sleep or bad diet, or is that not enough to affect it that majorly?
Bad diet, definitely. So I would say the commonest reason I see people in a general NHS endocrine clinic is because of obesity-related low testosterone. So it's chronic poor diet, and that may not be through choice. It might be social deprivation. It may be lack of understanding. It might be, they get into a cycle of weight gain, lack of exercise, weight gain, lack of exercise. So, the treatment in that situation is trying to normalise weight rather than give testosterone, but that's a difficult line to sit on, because if you've got no motivation, it's very difficult to normalise. So, again, you have to look at it in the context. So I think in that setting, I would be more concerned about what the reasons were before I went down to treatment.
My personal conclusion, having done my own research and after speaking to Dr. Saunders, is that there is a place for TRT, but only under very specific circumstances. By that, I mean individuals who are hypogonadal, whose bodies do not produce any or enough testosterone to live a normal, healthy lifestyle. And even in those cases, you should proceed with caution, supervision, and with the correct advice. You are also able to do a blood test, incidentally, which will determine whether low levels of testosterone are down to the body simply not producing enough or down to the brain not receiving strong enough signals to make it. Now, for those without a medical condition, but with low levels of testosterone, you could still, if you wish, build up a longer-term picture of what's normal for you through a series of blood tests, bearing in mind that it will naturally lower with age. You could also make sure that you address anything in your lifestyle that might be lessening your chances of producing normal levels of testosterone. Dr. Saunders mentioned that obesity is the main cause that he sees when it comes to low testosterone. Scientists and doctors think that might also be the reason why testosterone, on average, are at lower levels now than they were 40 years ago at population level. But in extreme cases, it might also be the exact opposite to obesity. Overextending in endurance exercise whilst under fueling is probably not going to be conducive to retaining healthy testosterone levels. So, for example, a study conducted at the 2011 Ironman World Championships found that only 9 of the 22 triathletes tested showed levels of testosterone that would be considered normal. So, like most things in life, balance is key, as is listening to your body. In general, a well-balanced diet containing essential fats and adequate protein will help keep your testosterone levels where they should be. Strength and resistance training has been shown to have a very positive effect on testosterone levels, and the more muscle you can employ during that resistance workout, the better the effect has been shown to be. i.e., bicep curls alone are not going to be as effective as a bigger compound movement like a squat. Beyond that, sleep is a massive consideration. Most of a man's release of testosterone occurs during sleep, and so if you don't get enough of it, or if it's inconsistent or disrupted, that will in turn disrupt how much testosterone is secreted. Dr. Saunders also mentioned that alcohol can negatively impact testosterone. Drinking an excessive amount interferes with hormone production and has been shown in multiple studies to reduce testosterone levels. However, the effects of nicotine are less clear-cut. In fact, the studies that have been done on nicotine and testosterone have had conflicting results, some suggesting it can lower it, and others finding that it actually increased it. So there are lots of fairly basic lifestyle choices that you can try to change or improve to have a positive impact on your testosterone levels. TRT is an option if you're hypogonadal, but you need to do your research and know what you're getting into. There are a lot of potential side effects to injecting a steroid into your body. They include mood swings, hair loss and hair gain in the wrong places, and reducing or even stopping your own body's ability to produce testosterone naturally. TRT definitely has its place for some people, and there are some very positive outcomes for those people. You just need to know what you're getting into and make sure that you're being well advised. Just finally, what about the ethics of TRT? If you decide to go down that road and you compete at a race of any standard, people in that same race are going to be a bit pissed off if you beat them and they subsequently find out. But should they be? That's another question I put to Dr. Saunders.
Wanted to talk to you about the ethics of TRT for somebody that's competing. And obviously, I don't mean in professional sport because obviously it's banned under the World Anti-Doping Agency. But there will be masters athletes out there who do have low testosterone, who are advised to try TRT to get themselves back to where they feel they should be. But of course, if you're competing against someone that you know has had TRT and they beat you, you are rightly going to feel a bit hard done by that they've effectively artificially boosted their performance. Where do you stand on that kind of thing?
I think if you're replacing a deficiency or an insufficiency to normality, then I don't have a problem with that. So if you're a 50 to 60-year-old man competing in an endurance sport and you've had appropriate assessment and you've found that your testosterone is subnormal, low normal, and you have symptoms that may be consistent with it, and if you replace that testosterone to what I would say would be normal levels for that age group, in the middle of the reference range, then that's fine. I don't see that, because the assumption is that people who don't have those symptoms are also in the reference range. I think the problems come when people push the envelope and they're trying to just top out towards the higher levels of testosterone that they can try and achieve. That is effectively covert doping, isn't it?
Yeah.
Now, whether this provides a short-term benefit in exercise is debatable, because it's more likely to be the effects of sustained chronic levels of normal or high normal testosterone that provide an additional benefit, such as that you'll see a rise in hematocrit, you'll see hemoglobin rise. For oxygen transport, that's clearly better. You'll see a more efficient metabolic state, and you can potentially see more stronger muscles or muscular efficiency. So, and that's the classic cycling reason for doing so, isn't it? But that wouldn't happen at physiological replacement, and therefore that's why I think it's reasonable for those people to sort of optimize, return to normal their physiology. But it comes back to, why is it abnormal in the first place? And, is it because they're chronically over-exercising that their testosterone's low in the first place?
Yeah, it's quite a dilemma, isn't it? Because, obviously I competed in the sport professionally, and the reason that I didn't do better was because I wasn't genetically as, obviously there's a bike handling and positioning component and tactics, etc. But primarily it's down to my genetics not being quite as good as the top riders at the time, the top riders now. And so I could sort of say, my levels aren't the same as yours, so I need to boost them. It's a very different case in the professional world of the sport, but you can see why masters athletes who haven't taken any supplements along those lines might feel a bit hard done by.
But equally, people can take herbal and plant-based supplements that aren't testosterone, that in some cases do cause a small rise in testosterone. Is that equivalent? Because they're supplementing with other things?
Yeah, true.
So it's a very debatable area in amateur sport, isn't it? What do you do to optimise your performance in really what is a game?
Yeah, exactly. Well, as you know, some masters athletes take things very seriously.
Yeah, absolutely.
You mentioned a couple of natural herbs and supplements there. What were you thinking about specifically there?
Well, fenugreek is often cited as something that lifts testosterone levels. There's some amino acid type supplements that are also associated with it. I haven't got the details in my head immediately, because it's not something I would recommend people try, but certainly I can give you the details if you want them, for personal use or otherwise. But there are things that are there, and there's a lot sold on the internet, and you'll find on the internet itself, testosterone boosters, these types of substances which are not illegal under WADA, that people will try to lift testosterone. On the whole, if you look at the analysis of all the things that are sold as testosterone boosters, there's maybe 2 or 3 things with some vague evidence that support that they will have an effect.
Okay. And just finally, there's a lot, again, on social media and podcasts, etc., about increasing protein intake, particularly as you get older, to conserve muscle mass and bone density, etc. Would increasing protein intake have any effect on testosterone?
Any food intake has a transient effect on testosterone production. As I said, the standard way to test would be in a fasted state, because that's when you get your peak level, or when the highest level of testosterone would be noted. But eating generally does have an effect on most hormones transiently. Chronic high levels of protein intake wouldn't necessarily affect overall levels of testosterone. And I think if you're thinking about the way testosterone supports muscle health and growth, it can only do so if there's sufficient building blocks to do so. And that really is framed by protein intake to a degree. And there's certainly a lot more robust evidence to say that sustaining an adequate or even a raised level of protein intake as we age is very supportive in terms of maintaining muscle mass. And I think that's a real important message that people need to take on, is we probably don't take enough protein in if you're exercising chronically.
It's a really interesting subject, the ethics of competition versus the want or even need to optimise your health. And it's a choice that could take on a very different level of importance in the near future. With AI learning accelerating exponentially, it is reasonable to expect that medical and genetic interventions will, in the not too distant future, allow us to live significantly longer and healthier lives than previous generations. In turn, then, it doesn't seem too far-fetched to think that competing in a sport and adhering to the rules of fair play in that sport might also mean you're having to make the choice between 2 vastly different health spans. There's a philosophical question for you. But one for another video. I hope that this one, though, has answered some of your questions on testosterone, what it is, what it does, and whether you should consider TRT. And I'd love to hear from you. Have you tried TRT? What impact did it have on your life? Are you considering it? If so, why? Let me know in the comments section below. And if you'd like to look at any of the studies that back up what Dr. Saunders and I have said in this video, you'll find them in the description below. Thanks for watching.